So here I'm presenting an abstract which was presented at St. Antonio Breast Cancer Society on December, which was conducted on December 7 to 10, 2021. So this is an abstract regarding the diffusion weighted MRI for prediction of pathological complete response in HER2 breast cancers with pembrolizumab plus neoadjuvant chemotherapy. Next, please. So this was the entire extract. Next, please. So pembrolizumab was the first immunotherapeutic drug which was evaluated by I-SPY2 trial. Pembrolizumab plus paclitaxel achieved nearly threefold pathological complete response rate over paclitaxel alone. Diffusion-weighted MRI demonstrated its ability to predict pathological complete response after 12 weeks of neoadjuvant chemotherapy in ECRIN 6698, which was a sub-study of I-SPY2 trial. This study presents the analysis of diffusion-weighted imaging for prediction of pathological complete response for the breast cancers treated with or without pembrolizumab. So these are the quoted images, how the cancers appear on diffusion-weighted ADC or DCE with, or dynamic contrast enhanced MRI studies. Next slide, please. So this was the study schema that an initial pretreatment MRI was obtained with diffusion, and T1 was obtained after 3 weeks of combined therapy or alone paclitaxel. So there was a patient cohort of 249 HER2 positive breast cancers. The experimental arm, there were 69 patients enrolled, and a combination of pembrolizumab plus paclitaxel was given to these patients, and there was a control arm of 180 patients who received only paclitaxel. The outcome measure was a pathological complete response on surgery. Next slide, please. So on the MRI, DCE MRI and DWI were required at a pre-treatment, and which was labeled as T0, and after 3 weeks of treatment, that was labeled as T1, of either paclitaxel alone in the control group or pacli plus pembro combination in the experimental arm. So DCE MRI, the functional tumor volume was calculated, which was a measure of vascularity. And on the diffusion weighted ADC images, which measured the water diffusion within the tumor. Mean ADC was used to quantify the tumor aggressiveness. Lower the ADC means more aggressive is the tumor. Next slide, please. Next, yeah, sure. So to assess the treatment response, a pre-treatment and a post-treatment, like after not completed treatment, after 3 weeks of the treatment, these two MRIs were obtained. So this is one patient whose ADC was, whose ADC was 1.05 into 10 raised to the power minus 3 millimeters cube plus per second at the pre-treatment level, and after 3 weeks, the ADC values raised to 1.13 into 10 raised to the power minus 3, showing that there was a response. Next slide, please. So the results were analyzed as area under the ROC curve of ADC or FTV at T1, and these were and these showed that ADC achieved higher area under curve than the FTV in the pembro arm, and ADC and FTV resulted in similar AUCs in the control group who were treated only with paclitaxel. Next, please. So this shows that in the experimental arm, like the patients who received pembro plus paclitaxel both, significant difference was observed in the ADC change for a pathological complete response versus a non-pathological complete response. Whereas in the control group, the difference in the ADC change for pathological complete response versus non-PCR was not statistically significant. Next slide, please. So with this presentation, they showed that FTV is a standard imaging marker. Generally it is said that the functional tumor volume is a standard imaging marker in I-SPY2 trial and has been used to adaptively randomize treatment. But this abstract showed that diffusion-weighted imaging ROI delineation strategy may help ADC to predict pathological complete response prior to FTV in cases HER2 breast cancers treated with immunotherapy. The study, however, has the following limitations. Sample size was prohibited because of the small sample size prohibited the subtype specific analysis, and the pembro arm treatment was a mix of pembrolizumab and paclitaxel. It was not pembrolizumab alone. Next slide, please. So this study concluded that diffusion weighted MRI may add value to DCE MRI in assessment of tumor response to immunotherapy at early treatment time point. So this study will later on be expanded to other immunotherapy arms in SPY2 as well. Next slide. So this is advocated in this abstract very well, that previous studies have shown that apparent diffusion coefficient adds through the value of functional tumor volume in prediction of PCR. In this study, ADC was tested for early prediction of PCR in the first immunotherapeutic drug evaluated in I-SPY2, and found that change in the ADC during the pembrolizumab plus paclitaxel treatment was more predictive of pathological complete response than the change in FTV alone. Next slide, please. So this was all. Thank you.